ayon sa NCR, DOH, hospital census. Ang highest percentage increase in admission ay ang severe case na makikita ninyo sa inyong screen na kulay violet. Kung ikukumpira ang admissions noong July 15 hanggang July 15, August 15, tumaas ang critical cases ng 109%. Ang critical cases ay 14% ng current admissions. Samantala, tumaas din ang severe cases ng 182%. Ang severe cases sa ngayon ay 26% ng current admissions. 60% naman ang itinaas ng moderate cases. Ito ang kulay berde sa inyong screen. 41% or majority ng current admissions ay moderate cases, no? Ang mild cases naman po ay tumaas ng 10%. Ang mild cases sa ngayon ay 9% ng current admissions. Panghuli, 124% ang itinaas ng asymptomatic cases, nasa 9% ng current admission po ito. Kaya nga po ang pakiusap po natin, kung moderate cases po yan o di naman kaya mild, pumunta na lang po tayo sa ating mga temporary treatment at monitoring facilities. Meron pong mga doktor din doon nang sa ganun, hindi po mapuno ng ang ating mga hospital na mga kaso na po pwede naman pong magamot sa TTNS. Okay, dito po nagtatapos ang ating presentasyon. Makakasama natin ngayon po sina DOH, USEC, Rosario Vergere. At kasama rin po natin ang ating matalik na kaibigan, Cebu City Vice Mayor and Acting Mayor Michael Rama. Puntahan po natin si USEC Vergere. Ma'am, maraming usapin tungkol doon sa tinatawag na strategiya kung saan pwedeng mabakunahan ang mga kasamang mga matatanda at mga kabataan sa isang pamilya. Ano po bang ibig sabihin nito? USEC Vergere.
Yes, magandang hapon po, Secretary Harry, and of course, magandang hapon to Mayor Rama and to the public. Ito po yung tinatawag na cocoon strategy, kung saan kung mababakunahan po natin yung mga nakapalibot sa ating mga kabataan ay mga kasama sa bahay, we will also be able to protect the children inside their homes. Secretary, I have a brief presentation if you would allow me to present, sir.
And USEC Vergere.
Thank you, Secretary. Can we have the slides, please, say? So magandang hapon po ulit sa inyong lahat. Kung susundan po natin ang ating presentasyon ni Secretary Harry Roque, next slide, titingnan po natin ang ating epidemic curve sa ating bansa. Tayo po ay nakakakita ng pagtaas kada linggo. Ang peak na nakita natin itong pangalawang linggo ng Agosto ay maikukumpara na sa peak na nakita natin noong April 2021. Dito po sa ating curve, ang National Capital Region with the dark blue bars, ang Region 3 with the yellow bars, ang Region 4A with the teal bars, and ang Region 7 with the orange bars ay nagpapakita ng pagtaas. On a national level, so mailalim na rin po sa pagtaas ng kaso nitong nakaraang linggo. Ang mga kaso po mula noong August 10 to 16, meron na po tayong 12,824 cases per day, ay tumaas ng 3,894 or 45% cases per day kumpara from the previous week of August 3 to 9 na meron lang tayong 8,930 cases. Next slide. Looking at the average cases and percentage change between June to August 1 to 12, 2021 per age group, may nakikita po tayong pagtaas ng kaso sa lahat ng age group sa ating bansa. Ang mga kasong naitala sa edad na 0 to 9 years old ay tumaas ng 1% noong Hulyo at 74% ngayong Agosto. Subalit wala pong malaking pagkakaiba yan sa kontribusyon ng bawat group sa total dami ng tao o dami ng kaso dito sa ating bansa. Kung ikukumpara po ang proportion ng bawat grupo ng edad sa pangkalahatang bilang ng mga kaso ng COVID-19 noong Hunyo hanggang Agosto ng taon na ito, makikita po na ang grupo ng edad 20 to 59 years old ay nananatiling may pinakamataas na proportion. Ang 0 to 39 years old ay tumaas ng 1 percentage point. Samantalang bumaba naman po ng 1 percentage point ang edad na 50 to 79 years old. Again, there is no large shifts in the proportion of all age groups because most of these remain the same as with the trends in the past months. Next slide, please. Kung titignan naman po natin ang average na bilang ng mga namamatay sa COVID-19 kada araw noong Hunyo hanggang Agosto ng taon na ito, deaths per day among 0 to 19 remained at less than 1 death per day, the smallest among all age groups. Deaths from June to August decreased, but we noted that it increased from 0.47 to 0.52 per day for the 0 to 9 years old. As of August 16, wala pang naitatalang nasawi mula sa Delta variant sa mga edad na 1 to 9 years old at 10 to 19 years old for both sexes. Kung ikukumpara po natin ang proporsyon ng bawat grupo ng edad sa pangkalahatang bilang ng mga namamatay sa COVID-19 noong Hunyo hanggang Agosto ng taon na ito, makikita po natin ang grupo ng edad 60 years old pataas ay nananatiling may pinakamataas na proporsyon. Ang pagkakamatay sa kabataan, edad 0 to 19 years old naman ay nananatiling 0 to 1%. Nagpapakita naman po ng pagtaas ang pagkamatay sa mga edad 30 to 39 years old at edad na 40 to 49 years old hanggang 3 to 4 percentage points. Next slide, please. Nananatili pa rin po ang ating National Framework for COVID-19 Response, ang ating Prevent, Detect, Isolate, Treat, and Reintegrate or PDITR Plus strategy. It works across all settings, even among the pediatric population. Alinsunod po sa strategiya na ito, may ilang rekomendasyon po para sa ating pediatric population. Para sa prevent strategy ng mga bata, lalo na po sa mga edad 2 taon at less, 2 years old and lower, sila po ay maaaring magsuot 2 years old and older, sila po ay maaaring magsuot ng face mask sa labas ng kanilang mga tahanan. Ang pagsuot po ng face mask ay hindi pinapayo or it is not recommended. Una, doon po sa mga batang wala pang 2 taong gulang. Pangalawa, kung nahihirapan pong huminga ang bata kapag nakasuot ng mask. Pangatlo, kung ang bata po ay may cognitive or respiratory impairments or conditions. Pang-apat, kung may panganib po na ma-choke o ma-strangulate ang bata kapag nagsusuot ng mask, kaya hindi po na muna natin sila pinagsusuot if they are less than 2 years old. Ang alternatibo po ay pagsuotin natin ng face shield ng ating mga kabataan kung sakasakaling sila po ay isasamang palabas for medical reasons. So next slide please. So ang mga batang natukoy na close contact at nagpakita ng simptomas ay maaring sumailalim sa COVID-19 test. Ito ay nakadepende rin sa availability ng test kits at dapat bigyan pa rin po nating priority ang mga batang nagpapakita ng malalalang simptomas. Parehong test po ang ginagamit para sa mga kabataan at sa mga adults. Maaari pong RT-PCR or rapid antigen test. In handling children for testing, maaari pong gumamit ng mga specific techniques upang masigurong kalmado ang bata habang ginagawa ang test upang maiwasang makontamina ang samples at magkaroon din po ng pagkakamali at maapektuhan ang accuracy ng mga resulta. Next slide. Para po sa mga batang may mild na simptomas, ang mga magulang o nagbabantay sa bata ay maaari muna pong kumonsulta sa doktor sa pamamagitan ng telemedicine. Ang mga batang nagpositibo po sa COVID-19 at walang simptomas o di kaya ay may mild or moderate na simptomas ay maaari munang alagaan sa ating bahay. Basta titiyakin po natin na nasusunod ang mga gabay for home isolation. Kung sila po ay nangangailangan ng dalhin sa ospital, ang bata po ay dapat may kasamang nakakatandang miyembro ng kanilang pamilya. Gayon din naman po kapag kailangan pong ilagay sa isolation facility, kailangan po kasama nila ang kanilang mga magulang. Kung hindi po ito pwedeng mangyari, ay maaring sa bahay na lang po mag-quarantine or isolate ang ating mga kabataan. Lagi po dapat may informed consent at saka clearance ng mga doktor ang mga local governments. Pag po tayo ay nag-a-advise na sila po ay dapat ma-manage sa isang facility, and I emphasize they should be accompanied by their parents. Next slide. So for reintegrate po, pareho po ang criteria natin for letting children who got infected with COVID-19 back into our communities. Katulad po sa mga nakakatanda, for symptomatic patients with mild symptoms, 10 araw po, plus 24 hours na clinically recovered na sila, maaari na po silang bumalik o makasalamuhan ng kanilang pamilya. For symptomatic with moderate, severe, or critical, 21 days plus 24 hours clinically recovered. Doon po sa mga walang simptomas but immunocompetent, ibig sabihin may iba pong sakit, kailangan po 10 days after positive test for SARS-CoV-2, and for close contacts who remain asymptomatic after 14 days po regardless po nung kanilang yung mga wala pa ho silang bakuna. So at least 14 days from the date of exposure. This is for adults po yung sa mga bakunado. Next slide please. Ang rekomendasyon po ng ating mga eksperto ay hindi muna po bakunahan ng ating mga kabataan dahil ito po ay makakaapekto sa supply ng iba pang priority groups gaya ng ating senior citizens. Mortality and morbidity data across age groups do not support the urgency to prioritize vaccination of the pediatric population as of this time. Cocoon strategy at pagbabakuna ng vulnerable adults ay makakapagbigay po ng proteksyon sa ating mga kabataan. Patungkol naman po sa administering booster shots sa kasalukuyan, hindi pa rin po nire-rekomenda ng ating mga eksperto ang pagbibigay ng booster shots or pangatlo or pang-apat na bakuna sa mga natapos ng bakunahan. Hindi kayang sugpuin ang transmission sa pamamagitan ng bakuna lamang. Ang pagsunod po natin sa minimum public health standards at PDITR strategy ay critical at importante po sa pagsugpo ng pandemyang ito. Next slide. So ang pagbabakuna po ng ating eligible individuals, right now po yung ating A1 to A5 ay mahalaga para sa proteksyon ng ating pamilya, kaibigan at komunidad. Next slide please. Ito ang tinatawag po na cocoon strategy. Ang mga nakakatanda sa bahay ay bakunado kaya mas mababa ang tsansa na magka-COVID ng mga bata. Kung tayo pong mga matatanda sa bahay ay protektado gamit ng mga bakuna at palagi ang sumusunod sa ating minimum public health standards, tayo po mismo ang magsisilbing proteksyon sa ating mga kabataan sa loob ng bahay laban sa COVID-19. And last slide, bago po matapos ang aking presentasyon, nais po lamang namin ibahagi ang mahahalagang takeaways sa presentasyon na ito. Una, ang PDITR Plus strategy po natin ay epektibo kahit po sa ating mga kabataan. Ang PDITR Plus ang tumutulong sa atin upang mapababa po natin ang mga kaso sa ating mga lugar. Kaya kasama po ang ating mga local governments, dapat po pag-igtingin natin ang implementasyon upang maprotektahan natin ang ating mga bata. Sunod, importante rin po ang minimum public health standards upang maprotektahan ang ating sarili at ang ating mga batang kasama sa ating bahay. Sumunod po tayo sa mga palatuntunan, ang minimum public health standards anumang oras at nasaan man po tayo. Pangatlo ay ang aming pakiusap na habang hindi pa po natin nababakunahan ang mga bata ay dapat magpabakuna na po tayong lahat na eligible. Kung kayo po ay nasa priority groups A1 to A5, tayo po ay magpabakuna na. Kapag tayo ay nabakunahan, ang ating po mga kasama sa bahay ay naproproteksyonan din po, katulad ng sinabi nating cocoon strategy. At panghuli, ang paalala po namin, hindi pa po tayo nagbibigay ng booster doses. Sa ngayon, ayon po sa pag-aaral at sa siyensya, epektibo po ang ating mga bakuna laban sa kahit na anong variants. Kunin lang po natin ang recommended na doses ng bakuna na nakalagay sa ating vaccination card. Ang Sinovac, AstraZeneca, Pfizer, Moderna at Sputnik V ay 2 doses lamang, habang ang Johnson & Johnson ay 1 dose lamang. Kaya tayo po ay fully vaccinated na, ay wag na po nating kalimutan, pero wag po nating kakalimutan na tayo ay mag-comply sa minimum public health standards para po tayo ay talagang maproteksyonan laban sa mga variants of concern na meron tayo ngayon sa ating bansa. Yun lamang po, Secretary, and over to you.
Maraming salamat, Yusek Vergere. Kasama rin po natin ang Vice Mayor ng Siyudad ng Cebu, who is actually the acting mayor sa ngayon po. No? Acting Mayor Michael Rama. Acting Mayor, alam po natin na sumipa rin ang mga kaso sa Cebu City at alam ko rin po na meron kayong executive order na in-issue para malabanan na itong pagsipa ng kaso ng COVID-19 sa inyong syudad. Ano pong dinadaman ng executive order na yan? Acting Mayor Michael Rama of Cebu City.
Una sa lahat, maraming salamat, Secretary Harry Roque, maayong punto sa tanan sa siyudad sa Subo. Executive Order 137, which is very famous in Cebu City as Oplan 8-15-31, it's more associated with Oplan Puyo. Sa Tagalog, Secretary Roque, manatili sa bahay. Yun ang general direction ng Executive Order 137. At saka, feature dyan, it's more on the so-called MSAO, which is an acronym, Mandatory Stay-at-Home Order. With that, we can easily address, kasi alam naman ni Yusek Rosette na this concern of our Delta or somehow something that has to be addressed on the community movement. We can readily reduce if walang masyadong tao nagko-converge, but focus only on essential, Secretary Roque. Kaya itong executive order na I have brought to the city government, it's not my executive order alone. It is a multi-sectoral, more or less supported executive order, whereby bottoms up ang approach dito, Secretary. Yung from the famous na sinasabi ko, which I thank you for highlighting it in our Republic of the Philippines, yung sinasabi kong PSHL, parang postscript saka high of law. Anong ibig sabihin ng PS at saka HL? Yung parental supervised household lockdown. Doon mismo sa pamilya, doon na exercise the parental authority. Papasok naman doon sa sitio, pwedeng ang punong barangay, if the situation warrants, with our Emergency Operations Center also being coordinated, and the mayor's office, they can even institute the so-called sitio lockdown. Then, going towards the chapel, involved na naman yung churches hanggang naabot doon sa barangay. Kaya nagkikreate tayo na mag-i-execute at saka mag-i-enforce itong Executive Order 137, yung tinatawag kong TFP, yung Task Force Puyo, parang Task Force Manatili, para doon mismo ang National Police, including yung Armed Forces of the Philippines, multipliers po, Secretary Roque, tulong-tulungan in the enforcement. Saka mayroon na doon, embedded na doon yung 700 men in uniform, including the multipliers, right in the barangay on the basis of the data. Doon na sila mismo at sila na ang mag-i-enforce, tulong-tulungan sa punong barangay, lahat ng mga multiplier mismo doon sa barangay. Saka itong Executive Order 137, meron ding feature where empowered yung mga barangay or punong barangay. Tawag ko nga sa kanila, mayores, 80 na mayors in the city of Cebu. Saka mayroong governor, yung ABC president, si Franklin Ong, saka yung vice governor, yung in charge ng peace and order, si Councilor Philip Sapra. Doon, mag-i-establish sila ng sinasabing protocol or shall we say quarantine points, and I call it barangay territorial management. Saka within, they are also, we are encouraging the establishment of inter-barangay protocol enforcement. At saka aabot hanggang doon sa intra-barangay, then LGU to LGU, shall we say, perimeter Spokesman. In the Executive Order 137 po, nandun rin yung ating ini-encourage to address the issue of food production, livelihood, and even addressing somehow in alleviating hunger, included in our, shall we say, Executive Order 137 po, we are appealing to the court na sana they would not be executing the demolition orders. Kasi pag mayroong demolition order, 2 weeks lang po ito eh. Then you will have unnecessary movement, stressful situation, then vulnerability comes. And I wish the court, with our executive order, would be able to have some breathing space para yun namang mga tao, puyo, manatili talaga sa bahay, saka only those na essential na pwede silang maggawa. Ang saka po, ang sama dito po, yung sinasabing task force puyo. Itong task force puyo po, it is composed of the Armed Forces of the Philippines, PNP, yung traffic enforcers natin, yung PROVE, yung nag-prevent, enhancement, notification, barangay captain or punong barangay, ating mga environmental officer, public information office, the force multipliers, at saka other agencies in government. This is headed po by our chief of police. At saka yung set up dito, it's more of clustering. 11 of our schools, Mr. Secretary, are now the house of our 700 men in uniform. And they are attended by our city government, department head or department. And I call it CAS. What is CAS? They will give care, attention, service, at saka they will be handled. And that's how we would like to have our addressing with
Acting Mayor? Acting Mayor?
Yes, Secretary.
Acting Mayor, we thank you po for summarizing the EO, pero mukhang kailangan na po tayo open forum ngayon dahil we will also give the media a copy of your executive order, no? But meanwhile, I think they may have questions for you on your executive order. So, with your indulgence, pumunta na po tayo sa question and answer portion po natin, no? So, thank you very much, Acting Mayor Michael Rama. May I call on Yusek Roque for the first question, please?
Yes, thank you, Secretary Roque. Good afternoon din po sa ating mga bisita. From Laila Salaveria na inquirer, what exactly does President Duterte daw po want to change about COA reports? COA has been issuing annual audit reports for years as part of its mandate, and this has been used to support the filing of criminal or admin cases. Does he have the authority in the first place to order COA when it is an independent constitutional body?
Well, una-una po, alam naman ng Presidente na independent constitutional body yan. No? Isa yan sa tatlong independent constitutional body na nasa saligang batas. So wala pong issue. Pero ang issue siguro ng Presidente, yung proseso di na nasa saligang batas. So wala pong issue. Pero ang issue siguro ng Presidente, yung proseso. Meron kasing initial observations, bibigyan ng pagkakataon yung ahensyang sumagot, pagkatapos ng pagsagot nila, yung magkakaroon sila na parang exit conference, tsaka magkakaroon ng final report. Siguro gusto mangyari ni Presidente, huwag munang isa publiko ang preliminary observations na hindi pa naman nasasagot ng mga ahensya. Kasi pag nalathala na sa media, yung preliminary observations, para bagang nagkasala na yung ahensya, no? Na naging personal niyang karanasan. At sabi nga niya, 2 beses siyang tumugon sa kataas-taasang hukuman at sa Court of Appeals laban nga sa mga preliminary observations na meron ng COA. So, talaga naman pong obligasyon ng COA na gumawa ng final report on an annual basis, siguro yun talaga ang dapat i-publicize.
Apo, ang second question po niya, the President said officials should just ignore the COA. Is this going to be the official policy of the administration? COA reports have been a tool to combat corruption. Why would he want officials to ignore this?
Wala pong issue yun, no? Pero yes, ang sinasabi lang ng Presidente, frustrated siya. Kasi ang basa ng taong bayan sa initial observations, meron ng condemnation. Hindi naman po ganun ang proseso. Kasi pati sa COA, alam nila na initial observations, sasagutin, tapos tsaka sila magkakaroon ng final report. So, ang sinasabi lang po siguro niya, it's not necessarily just for government, no? Pero wag muna natin bigyan ng mabigat na halaga yung initial observations dahil yan naman po ay sasagutin pa, no? At pagdating po dito sa DOH, ako mismo nag-rely lang ako sa media report, no? Parang lumalabas na 60 billion hindi nagastos, pero katotohanan pala 60 billion ay hinahanapan lamang ng MOA, no? Pero ginamit naman yun pambili ng mga PPEs at iba pang kinakailangan natin. So yun lang po ang pakiusap ng Presidente sa kanyang mahabang karanasan sa panunungkulan sa gobyerno. Talagang yung mga initial observations na yan, wala naman pong masyadong mabigat na sinasabi yan dahil po pwedeng sagutin ng mga ahensya.
Third question po niya, hospitals are already straining to care for COVID patients. How can government ensure there will be enough health workers to care for patients when nurses are resigning due to low pay and exhaustion?
Alam nyo, nung nag-inaugurate po kami ng 108 additional beds dyan po sa lung center, no? Kinakailangan syempre ng mga additional nurses. Pinagpapala naman po tayo ng Panginoon dahil we produce surplus graduates of nursing, no? At inaasahan po natin na yung mga bagong graduates natin can be called upon to serve in the additional beds that we have established para nga po pagsilbihan yung mga magkakasakit ng COVID.
Opo. Thank you, Secretary. Susunod po si Pia Rañada ng Rappler.
Hello, sir, can you hear me?
Sa Piero Nada,
Okay, sir, can you hear me?
Piero Nada,
Hello, sir? Hello?
yes, go ahead, go ahead.
Okay. Sir, just on the President's remarks last night about COA, do these threats to COA for doing its job have a place in a democracy like the Philippines? Kasi pwede naman yung sabihin yung criticisms niya in a way that's not threatening, not
I think he made
criticism.
I don't think he made any threats. He expressed frustrations, no? Kasi nga, kung babasahin mo yung mga nalathala based on the preliminary observations, para ba hindi ginastos ng Department of Health ang 64 billion, no, sa panahon ng pandemya. Hindi naman pala ganun, no? Ang hinihingi lang nila yung MOA. So, unnecessarily, na-rile up, no, na bahala yung taong bayan, hinihingi lang nila papel, MOA, na hindi naman pala dapat ibigay pursuant to GPPB resolution.
But why curse COA, and why we also have to recall that in 2019 and 2018 he actually joked about torturing, kidnapping COA personnel. He also joked about throwing an Ilocos Norte auditor down the stairs. I mean, even if you say these are jokes, diba? I mean, it could also scare certain people into thinking that the president, far from appreciating COA's work in anti-corruption, actually don't want them doing their job. So how can COA now do its job impartially with these kinds of remarks looming over them, coming from the president himself?
That's just his style. You can't teach an old horse new tricks, okay? And people have accepted him for how he is, no? That's why he was elected despite the fact na alam natin kung paano talaga ang kanyang kasta, no? Now, how does the Constitution protect the independence of COA from appointment to tenure to fiscal autonomy? All these are constitutional guarantees that the Constitutional Commission will retain their independence from the other branches of government.
But what's to stop, sir, like COA personnel from taking to heart the threats? Because even if you say that's his style, I mean, that's not gonna cut it because his style is threatening and it could be jeopardizing democratic process in our government. So how do you assure COA personnel themselves from being fearful into doing their job in actually impartially investigating these government agencies?
I have filed many criminal cases against government officials on the basis of COA report. COA personnel are always under threat, pero to their credit, pinakita po ng mga opisyales at manggagawa ng COA that they are true to their oath of office and they are true to the mandate of this constitutional body.
So they must do their job despite the threats from the president. Can the president simply control his words and maybe be a bit more diplomatic with how he relates his criticisms? For the sake of the democracy of the government.
Yeah, that's how good our civil servants are. Let's give them credit.
Lastly, spokesperson, is the president now precluding any findings on DOH corruption? Because won't his remarks now, for example, preclude any probe into the actual findings? Like, kasi sabi wala namang outright corruption na nahanap, but what if a probe could unearth something that now the president is endangering because of his remarks?
All probes can continue. The President has no power to prevent the House nor the Senate from investigating. The President cannot control the Ombudsman if it can investigate. Pero in this particular instance, malinaw, ang impression ng publiko, hindi ginastos yung 64 plus billion sa panahon ng pandemya. E nagastos naman pala ang hinihingi lang MOA. Eh yun lang po ay meron naman palang resolution, no, na hindi naman dapat i-attach o magkaroon ng ganyang MOA, no, sa mga ordinaryo mga pangangailangan. So yun lang po. It unnecessarily alarmed people when all they needed was a paper which was not required, apparently, according also to government rules.
My last question is for Vice Mayor Rama. Vice Mayor, because the holidays are approaching and we have a question from Ryan Macasero of Rappler Cebu. Is the Cebu city government considering canceling or postponing Sinulog next year due to the surge, the cases?
What is incumbent right now, of course, Ryan is to curb our challenge with this pandemic. It's not yet a sinulog matter that we are focusing on. But definitely, we cannot just ignore because sinulog has been a part of the body system of the Cebuanos and even the country. We can still continue as we did before, some innovation, virtual, or whatnot. Definitely, our focus as the acting mayor, with the help of the national government, with Secretary Roque and Senator Bongo, we are fighting this pandemic. That is the focus that we have at present.
All right, thank you, sir.
Welcome.
Balik tayo kay Yusek Roque, please.
Thank you, Secretary Roque. From Criso Remate Online, Secretary Roque sa Talk to the People daw po ni Pangulong Duterte kagabi, sinabi niya na hindi niya tatanggapin ang pagbabitiw sa pwesto ni Secretary Duque. Ibig bang sabihin nito, dead ma lang ang Pangulo sa mga kontrobersya na kinakabit kay Secretary Duque?
All cabinet members serve at the pleasure of the President, and Secretary Duque, according to the President last night, continues to have his full trust and confidence.
Second question po niya, may sinabi si Attorney Matimbaga, Secretary General ng PDP Laban na may 6 hanggang 7 cabinet members daw po ang kinukonsidera na isabak sa senatorial slate. May idea ba o impormasyon kayo kung sino-sino daw po ang mga to at kasama po ba kayo sa sinabi ni Attorney Matibag?
Hayaan ko na muna po yan, no? Dahil ngayon po ay nakatutok pa ako personal dito sa COVID response na ating gobyerno at sa ating COVID communication. No? Pero I will let the PDP Laban answer that question po kung sino yung mga naiisip nilang patakbuhin.
For Undersecretary Bergere, nagbabala po si MMDA Chair Abalo sa mga LGU hopping, sa mga nag-LGU hopping para makakuha ng booster shot. Kailan ba ang tamang panahon para magpa-booster shot?
Yes, si Sec. Roque. So sa ngayon po, pinag-aaralan pa rin po ng ating mga eksperto. Kailangan po maintindihan ng ating mga kababayan na ang COVID-19 vaccines natin ngayon, bago po ito po ay una pa lang na ginagamit sa buong mundo because of this pandemic. So kailangan kompleto pong ating ebidensya to ensure that we can provide safe vaccines to everybody. So for these booster shots, na lumalabas pa lang pong full evidence across the globe will be the platforms for AstraZeneca and the mRNA vaccines. Wala pa po yung mga ibang bakuna na commonly ginagamit natin dito sa bansa. Kaya hindi pa po yan talaga mabigyan ng rekomendasyon ng ating mga eksperto. Pangalawa, looking at that equity side, marami pa po sa ating mga kababayan ang hindi nababakunahan. Kaya po minamabuti ng ating gobyerno, and based from our objectives of population protection to combat these variants of concern, kailangan mabakunahan as much of the population that we can vaccinate at this time para po maproteksyonan laban sa Delta variant na kumakalat sa ating bansa. So nakikiusap po tayo na sana wala muna pong magpa-booster, walang mag-hopping from one vaccination site to another. I-reserve po natin yung mga bakuna dun sa mga taong hindi pa po nababakunahan.
Thank you, Yusek Merere. Secretary
Okay, susunod na magtatanong ay si Leigh Alvis of GMA News.
Secretary, I think
Yes ba o si
Trisha
Trish Terada pala? Sorry. I'm sorry. Zoom number 2 is Trish Terada. Go ahead please, Trish.
Hi, Spokes. Good afternoon, and to all our guests. Sir, first, a few questions for you. No? Where did the president, or was the president actually privy into the details of the COA report? If so, sir, how did he react about yung items that seem to be a little bit overpriced? Like, for example, the purchase of laptops, apat na laptops worth 700,000 pesos. And aside from DOH, yung other reports, sir, na, for example, does the president know that the LTFRB only used 1% of the 5.5 billion funds meant for driver's aid? And how did he react to this, sir?
Well, sabi nga niya kagabi, no, as a long-time servant of government, alam po niya na limited ang utility ng mga initial observations ng COA. Kasi ang proseso, pakukomenta naman ang ating mga ahensya. It is only after the comments are submitted that they finalize their reports. So sa mahabang karanasan niya sa gobyerno, more often than not, these observations are easily answered by the agencies. At yan nga pong pananaw ng Presidente pagdating po dito sa naging initial observations sa DOH.
So what does the president's reaction say about kumbaga sir yung behavior na, for example, dito sa COA report, he was very frustrated with how it seemed that the officials or government officials were accused of corruption. When at the same time, sir, kung halimbawa, for example, yung mga drug matrix na nalabas previously were not properly evaluated, why does the president did not react that way to such kinds of evidence in the past na wala talagang proof at all compared to this one that has been done by, by a reputable state auditors? Is there double standard?
Trish, because COA itself came up with a clarification that they were not accusing the DOH of any misappropriations. Naglabas po talaga sila ng clarification, no? So wala. COA na naglinaw na hindi nila pinaparatangan na nagungurakot ang DOH. So what do you expect the president, how do you expect the president to react? And of course, COA had to make that clarification kasi naging public opinion is baka nga nagkakaroon ng kurakutan dyan, no? Eh wala naman po dahil it was apparently what was reported in the media was an instance of non-feasance. Ito po yung sinabi ni dating Senadora Escudero, no? Failure to spend. Eh wala naman palang failure to spend. Ang hinihingi lang naman pala nila, MOA, which are two different things, no? So makikita natin na ibang-iba yung naging public perception pag binasa mo yung kanilang initial observations sa hinihingi naman pala nila.
Is the president still interested to look into the specific details, like of other details in the core report, to see if there was really deficiency, if there was really corruption, or parang does it end there with what he said last night?
From his experience, dapat antayin ang final report. And that would, in fact, stand as evidence in court.
Sir, maybe final question for you and to Yusek Bernere. Because later, sir, alam ko yung IATF. Ano po, sir, yung general sentiment ng composition ng IATF? Ano yung mga points of contention about the possible extension of ECQ or de-escalation? And to Yusek Bernere po, what would the DOH recommend about the next quarantine classifications, especially in NCR, from a medical standpoint?
While una, Trish, wala pa pong kahit anong consensus. Bakit? Wala pa po kaming nakukuha ang report as far as data is concerned. Pangalawa, again, I will say that our objective is to achieve total health. No? Hindi naman po pwedeng mapapababa ang numero ng mga COVID, samantalang napakataas naman po na naghihirap dahil sa kagutuman. So I think we are one in IATF to find that delicate balance of total health. Pero sa ngayon po, kinakailangan makakita ang datos because all the decisions of the ITF are data-driven. Perhaps Yusek Vergere can answer your second question.
Yes, Sec. So seconding what Secretary Harry Roque has mentioned, no? So that balance between health and the other sectors in the population. Pero gusto lang po natin ipagbigay alam sa ating mga kababayan na hindi lang po lockdowns or these restrictions ang ating pong nire-relayan so that we can stop the transmission of this disease. Kailangan po lahat ng components ng ating response na i-considera natin. So when we talk about the other components, we talk about the community during this time of the restriction. So we have observed that there is still 39% more mobility compared to the previous ECQ that we have done during March and April of 2021. Also, we have noted thousands of violators being reported by the Philippine National Police. So that in itself, if we look at that, this shows us the compliance of people to safety protocols and also the compliance of people to these restrictions. But we cannot also discount the fact that because there are workers going out, that's why mobility is still there. But what we are trying to say would be that even though we will have these very strict restrictions katulad ng ECQ, kung hindi po tayo makakapag-comply ng safety protocols like nagmamask ang mga tao, hindi nagkakaroon ng gatherings, at saka kung hindi po natin malilimit yung ating mobility for those non-essentials, hindi rin po magkakaroon ng success or hindi natin ma-achieve ang objectives natin. So for now, what we are discussing and analyzing in DOH will be these different components because the projections are saying even though we will have this kind of restrictions like ECQ, but if we cannot be able to restrict the mobility and the compliance to these health standards, plus if we cannot shorten the duration from the time that we have detected a patient with symptoms or are sick of COVID-19 and them being isolated within 24 hours, cases will continue to increase. So that is what we are going to present to IATF, and of course, it will always be the IATF officials to decide on this.
Okay, thank you very much, Yusek.
Online, over 500 days daw po into our COVID-19 lockdown. And as we face the threat of the Delta variant, why does the President talk to the people still air in the wee hours? Kung ang goal po ay kausapin ng mga mamamayan, bakit hindi ini-ere ang speech ng live kung kailan mas maraming tao ang gising pa?
Wala namang pong problema maski ma-area ng gabi kasi kinabukasan, really replay po yan ng PTV4. So yung mga hindi makakapanood ng gabi, makakapanood po sa the following morning.
Second question po po niya, the President says there were no string attached with China's delivery of COVID-19 to the Philippines. I think COVID vaccine to. The Philippines accept that their boats are there. What did he authorize? Why did he authorize Chinese boats to do in the West Philippine Sea?
Hindi naman po niya inauthorize yan. That's a statement of fact. At kahit palayasin natin sila, hindi naman sila aalis, no? Basta ang sinabi ng Presidente, kung mananatili mga barko niyan, diyan ang mga barko ko sa Coast Guard at sa aking Navy, mananatili rin para protektahan ang aming karagatan.
Third question, why does the President say it's pure bullshit to assume that there is no corruption with the COA flag DOH funds when auditors have yet to make their final report? And why did he tell auditors not to publish the reports when that is their mandate? Similar question with the Nesca Panty ng GMA News Online.
Sagot ko na po yan. Ang ayaw niya ay yung initial publication ng initial observations bago pa matanggap ang sagot ng mga ahensya na wala namang pong conclusions pa. Kasi even COA stress na wala silang conclusion of any malfeasance or non-feasance.
From Cap Domingo ng ABS-CBN News for Yusek Berhere, yung DOH daw po earlier said that portable air purifiers are ineffective in protecting people versus COVID-19. Katulad ba daw po ito ng findings ng larger air purifiers na ginagamit sa restaurant? Does the DOH recommend the use of these larger air purifiers?
Yes, Yusek Rafi, no, actually we have our Living CPG group. This is a consensus panel of experts kung saan pinag-aaralan ng mga teknolohiyang ganito. Nagbigay na po sila ng rekomendasyon, and even DOH gave that recommendation against the use of these ionizing air purifiers yung nilalagay sa ating mga leeg dahil hindi po ito nakakapagbigay ng protection sa ating mga kababayan. Now, as compared to these HEPA filters po siguro ang sinasabi nila for these mga establishments na naglalagay nito, especially dun sa mga enclosed spaces, atin pong nire-recommenda yan because that also provides itong filtering mechanism that can help in the air circulation in this large establishment. So hindi po natin pinagbabawalan ng mga HEPA filters na ginagamit dito po sa mga restaurants and offices.
From Red Mendoza ng Manila Times, sinabi ng mga progresibong health worker na sinungaling umano ang DOH dahil ilang beses na raw pong napapako ang pangako nila. Gusto rin nilang paalisin sa pwesto si Secretary Duque at palitan daw ang buong IAT at ng mga tunay na eksperto, pero hindi nila nabanggit kung sino naman ang kanilang sinasuggest. Ano po ang masasabi niyo dito?
That's a question for you, Sec. Vergere.
Okay. Yeah. So unang-una po, nasagot na ho ng Pagawalan ng Kalusugan lahat po ng mga audit findings namin through our media report yesterday. Gusto lang ho natin paalala sa ating mga healthcare workers na bukas naman ang aming tanggapan para dinigin ang inyong mga kahilingan o mga complaints nyo para mas mapaintindi rin po namin ang aming punto na lahat po ng mga benepisyong binibigay sa ating mga healthcare workers should be aligned with what is written in the provisions of the law and existing policies of government. So sometimes there are delays in the release because hindi pa rin mo makapag-comply ang mga hospitals nyo sa pagsusumite sa ating regional offices. So just to be clear, ito pong mga benepisyo na pera po na pondo base po dun sa listahang pinadala sa amin who are eligible to be given these benefits ay naibaba na ho natin sa ating mga regional offices and hospitals since June 30 of this year. This is worth about 9 billion pesos para po dun sa lahat ng eligible. Kailangan lang po kumpletohin nila yung kanilang mga requirements for documentation so that we can be able to provide that because we are also following government procedures and we cannot just release the funds without further validation and evaluation of the submitted documents.
Thank you, Yusek Bergere. For Secretary Roque, from Red Mendoza ng Manila Times, pag na-implement na ba ang digital vaccine passport, ire-require ba ito sa lahat ng establishment at bakit hindi na lang ma-integrate sa Stay Safe ang digital vaccine ID para isang app na lang ang pwedeng gamitin?
Ang WHO po, nung require nila itong digital vax certificates, sinabi na dapat fully operable yan. No? So, WHO, interoperable. Yes.
Secretary, I'm sorry pero mukhang naputol po kayo doon. Pwede po nga pakiulit. Tumigil po ang video nyo.
Okay, gaya po ng requirement ng WHO, itong ating digital certificates no, must be interoperable. So talaga po magagamit yan with Stay Safe.
Thank you, Secretary Roque. From Day Alves ng GMA News for Yusek Berhere. Yusek Berhere, hindi ko po alam kung nabanggit nyo na rin ito, pero basahin ko na lang po. May karagdagang impormasyon bang nakalat tungkol sa unang kaso ng Lambda variant sa bansa? Natukoy na ba kung saan siya nahawa?
Yes, Yusek Rafi, no? So ito pong Lambda case natin was PCR tested last July 3 as a screening done by their health facility, local health facility dun sa lugar nila. Wala po siyang simptomas. She was isolated in a facility last July 17. On July 22, she went into labor because she was pregnant and gave birth to a live baby. She was tested the same day and was positive. So she remained in isolation and has completed isolation last August 6 po. So tinake uli yung kanilang swab ng kanilang anak at ito po ay ating pinoproseso ngayon. So wala po tayo nakikita base sa contact tracing reports dito po sa individual na ito na meron po siya nakasalamuhan na returning overseas Filipino o di kaya mga tao no na dun sa mga clustered areas diyan sa kanilang lugar. So magbibigay po tayo ng iba pang informasyon in the coming days as we do the sequencing also of the other members of this community.
Thank you, Yusek Berhere. From President Catarong ng SMNI for Secretary Roque, reaction daw po sa sinabi ni Senator De Lima, quoting, Mr. Duterte, in a pandemic, all dogs must learn new tricks, save lives. He, the VP, sa call for improved contact tracing and testing or your pride will be the death of more Filipinos, end quote.
No reaction po. Rumblings of a woman detained of her liberty.
Thank you. Thank you, Secretary Roque. From Evelyn Quiroz ng Pilipino Mirror for Yusek Berhere, the Department of Health daw po recently said ng creation of Philippine Center for Disease Control and Virology Institute will prepare the country for future pandemics through research, coordination, and surveillance. Is this not a case of doing something too little and too late, considering that resources should be allocated to the immediate vaccination of the general population?
Yes, Yusek Rafi, no, meron tayong pondong nakalaan para sa ating mga pagbabakuna. Meron din pong pondong ilalaan kung sakaling ma-finalize na po itong mga bill na ito sa ating Kongreso. Kailangan po nating tandaan na hindi po tayo pwedeng maging reactive lang. Kailangan proactive din tayo. That's why we are preparing for possible future pandemics, kaya po natin itinatayo ang mga institute na ito. Actually, decades ago, meron na po tayong simulan sa RITM nitong vaccine institute natin. Hindi lang po na punan ng pondo at hindi na ipagtuloy. Ngayon po, nire-reactivate natin and we're making it more comprehensive at mas gusto natin ay mas maging rational po ang pagsasagawa natin ito. So this is really preparing for the future of the country.
Thank you, Yusek Berhere. From Maricel Hanini ng TV5 for Acting Mayor Rama, can you confirm reports na may isa daw pong abandoned building sa Cebu City ang ginawang tambakan ng cadaver? Based on initial reports, about 16 bodies were found in the building and 3 of these were COVID cases. Kung totoo daw po ito, Acting Mayor Rama. Nakamute po yata kayo.
I overheard about that matter and I already instructed Councilor Dave Tumulak to go deeper so that we will be able to bring about what really is happening. But we will look into it and seriously look into it.
Thank you, Mayor Rama. For Yusek Berhere, galing pa rin po kay Maricel Hanini. Can you reiterate the protocols for COVID deaths? Ano po ang guidance for LGU ngayong dumarami ang kaso ng namamatay dahil sa COVID? Mukhang hindi kasi kinakaya daw po ng ilang crematorium na ma-accommodate lahat ng cases. Advisable ba ang mass grave gaya ng ginawa sa Aklan?
Yes, Sir Rafi, no? So meron po tayong polisiya na ipinalabas na ng Department of Health last year pa, yung DM number 2020-0158. Meron din po tayong batas na sumasakop dyan na lahat po na mamamatay ng infectious diseases kasama po ang COVID-19 kailangan within 12 hours ay mailibing o di kaya makremate. So dun po sa mga perception ng iba kasi akala nila cremation lang ang pwede. Ayon naman po sa ating batas at sa ating polisiya, maaari naman po tayong maglibing basta may 3 bagay tayong dapat siguraduhin. Ang unang-una, dapat within 12 hours ay mailibing natin sila kung hindi sila kayang i-cremate. Pangalawa, dapat wala pong embalming na mangyayari. So kung ililibing po ang ating mga kababayan na matay, kailangan ibalot po, this is the third condition, ibalot sa double bags po sila, appropriately sealed. At pag na-seal na po, hindi na po pwede uling buksan. At pagkatapos, bawal po tayo mag-embalsamo. Ang isa lang kung gusto rin namin ipaalala sa ating mga kababayan,